HIV/AIDS rates in the Philippines have been rising to unprecedented levels in the last few years, and we are in the midst of a full-blown epidemic. Last year, a record number, 835 cases were diagnosed. In January, the highest number of cases ever reported in a month, 135, was recorded. The HIV/AIDS clinic based at the Philippine General Hospital has been seeing an increasingly large number of patients presenting with AIDS and end-stage HIV infection, prompting the physicians involved to initiate emergency measures and improve the clinic facilities and ramp up prevention strategies. In an effort to counter AIDS, Sojourn Mega Manila presents an audio-visual of AIDS epidemic in the Philippines.
Well, HIV and AIDS are basically related because HIV stands for Human Immunodeficiency Virus. So this is the virus that causes AIDS, which stands for Acquired Immune Deficiency Syndrome. When you get HIV initially, you don't really know that you have it, and it takes up to 8 to 10 years before you start developing symptoms. And after 8 to 10 years, then you develop what we call AIDS, or Acquired Immune Deficiency Syndrome. HIV/AIDS actually probably originated from monkeys somewhere in Africa. There was transmission most likely between hunters who hunt the chimpanzees or the gorillas, and then when they chopped the meat, there was some crossover of the virus from the blood of the monkeys, and eventually it made its way to the larger population of the world. We have effective treatment. We've gone a long way in the last 25 years, but unfortunately right now there is no cure. In general, it's actually pretty widespread in the world. The bulk of cases, around 40 million cases, have occurred mostly in Africa, and from there's 1 million cases in the United States. Over the last few years, we've seen a decline in the number of new cases in the world, and this is a result of the outpouring of support from nations and from philanthropic individuals, including the Global Fund, where we've seen the availability of effective antiretroviral drugs, which by the way are very expensive, and we've seen a 17% decline in the total number of new cases over the period of 2001 to 2008. The first 2 cases of HIV in the Philippines were documented in 1984. And for the longest time, the number of cases has really been stable, around 120, 150 per year. In the past 5 years, the average number of cases has been around maybe 20 new cases a month. But what has been really alarming is that in the past 3 years, between 2007 to 2009, we've seen an alarming increase. It more than doubled. Under 300 cases in 2007. For the whole of 2009, we actually reached 835 cases. Towards the end of 2009, every month was a record number of new cases. In November, we had 80 new cases, which was a record. And then in December, we had 126 cases. For the first month of 2010, in January, we had 143 cases. In the last maybe 3 years, we've really seen a dramatic increase in the number of cases. Person who is in the high-risk group, whether they be commercial sex workers or they're IV drug users or men who have sex with men, they have anywhere from a 50 to 200 times higher risk of contracting HIV than the general population. So that is very alarming. How effective is our prevention program for HIV in the Philippines? Just consider one particular statistic. 90% of HIV in the Philippines is transmitted to unprotected sex. It's being transmitted in a manner which can be prevented using condoms. Really speaks to the fact that we haven't really educated our people enough. Really is important that children and young adults who are just about to become sexually active have a reliable source of information, because if it's all just from their peers, then the kind of education that you're going to get out of that is suspect. And if you have wrong information, particularly with HIV, then the consequences can be lifelong and in some cases may be fatal. In our history for the HIV problem in the Philippines, early on, most of the transmission was actually occurring internationally. A steady number of OFWs that we're seeing that are acquiring HIV abroad, the number of local transmission has actually ballooned. It has actually gone up. Our HIV problem is something that is imported, or is it local? But now there's really no doubt. It really is a local problem. The 100% foolproof way to avoid HIV is really abstinence. Patients who have HIV also, the way that they can not transmit it to other people. The second component of education is be faithful with a non-infected partner, and that goes for both, you know. And if that can't happen, then this is where we get into the issue of condoms. Because condoms are maybe 85 to 90% effective, so there's still a 10% failure rate. But even in the studies, the reason for the failure is not because of the condom itself. It's because people don't consistently use them. And so in general, it is the most effective thing we have. The only 100% thing effective is still abstinence. A lot of our patients are merely HIV positive. They're not, they don't have full-blown AIDS yet. And if we get them on medications, then their chances of going into full-blown AIDS are much lower, actually. And a lot of them really do live longer lives than they would have been. So that was the kind of message, very positive, that I can tell my patients, you know, I have effective treatment. I don't have a cure yet, but who knows? Maybe next year we have a cure. And on top of that, if I can keep you alive to next year or the year after that when we have a cure, then you're cured. As opposed to telling them 25 years ago, you're going to die in a month. It's a very positive message. The biggest problem with HIV is that there's really a lack of knowledge and misconceptions about it. People think that, you know, if you shake somebody whose hand who is HIV positive, you'll get HIV. No, the only 3 ways that you can get HIV are through sex, through a blood transfusion, or blood products, say if you get a needle stick with HIV positive blood on it. And the third is maternal child transmission, which can be prevented, by the way, as long as we put the mother on proper therapy. In terms of HIV/AIDS in the Philippines, it's really here to stay. We're in a full-blown epidemic. Our numbers are drastically increasing, and that is very concerning because HIV is not an easy disease to treat. HIV is treatable. There is no cure just yet. You are having unprotected sex, and it's important that you realize that there are measures that you can take to protect yourself, and that includes condom use, but more importantly, you know, as much as possible, it's important to be faithful or be abstinent. If you think that you have been exposed, then it's important to get tested as early as possible, because we can help you, and we can help you live longer. If you do test positive, we will take care of you. We have free medications in our clinics. We have very good doctors who can ensure that your life is as productive as we can make it.
The article also noted that an increasing proportion of new HIV cases in Asia are in men who have sex with men, and this proportion has skyrocketed, going from less than 40% of cases to 70% currently. The United Nations Joint Program on HIV/AIDS forecast that without more aggressive measures, MSM could become the primary reason for new HIV infection in Asia, reaching 1 million cases a year by 2020.